Hey YouTube, it's Mikey here. Look, I'm here to talk to you about what the coronavirus is doing to the healthcare system in the state that I live in Alabama, and talk to you about some options as to why you probably shouldn't go to the hospital right now. As well, I'm going to talk about the state of the EMS system. I stream over on Twitch. You can come check me out. It's twitch.tv/Garza_205. A lot of my community doesn't know that I'm actually a full-time paramedic, so I'm around this stuff almost every day. All right, first and foremost, this is not to tell people that they shouldn't go to the hospital if they need to go to the hospital. Number two, this is not a video on the vaccine. It's your right if you choose to get the vaccine. Welcome to America, the land of the free, where you get to choose what you do with your life. I personally got the vaccine because I was around this every day, and I wanted to better take care of myself and protect myself and my family, because I have a couple of family members that I want to see, and they're kind of susceptible to the effects of the coronavirus. The hospitals in the state of Alabama have no ICU beds available. We're constantly picking up patients on the ambulance and taking them to the hospital for ailments, toe pains, all this other stuff. And we're having long extended wait periods at the hospital, sometimes up to 4 hours sitting in the ER waiting to get a room. And it's nobody's fault. It's just solely because of the coronavirus that the hospitals are just overrun with patients right now. But I wanted to really reach out and talk to some of the people out here in the community of Alabama, and urge them, if they don't really need to go to the hospital, if it's something that you can call the next day and consult with like your primary care physician, or if you can fix what's bothering you with over-the-counter medicines and rest, I would strongly suggest you do that, because if you don't have the coronavirus now, you go to the hospital without it, you will have it when you leave. It's really, really taxing our system, and it's causing a lot of issues, such as some patients that really need to go by ambulance to the hospital are having to wait long extended periods of time because a lot of the ambulance crews are held up at the hospitals waiting to get a room. So the communities are having to wait sometimes upwards to hours for an ambulance to get there. There's just no help. And there's such a shortage of paramedics and nurses that it's really, really causing a problem. If you have a common illness or an ailment such as knee pain, toe pain, I got a headache, I got like sore throat, stuff like that, I highly suggest you just stay at home and consult with either your primary care physician via telehealth, or go to one of these clinics out here that are readily available for those common illnesses and ailments. Also seek over-the-counter medications for muscle pains, joint pains, stuff like that. I would suggest taking some type of anti-inflammatory, rest, ice, simple fixes. And even if you have the coronavirus and you're not really having severe symptoms from it, I would suggest you stay home as well. And take over-the-counter medications. You can look those up online, and you can contact your local doc in the boxes, primary care physicians, and they can give you a better description of the medications that you would need to be able to, just wait it out. The thing with viruses are there's really not any medications that actually kill it. It's something you kind of just have to wait out. And that's unfortunate. This should be taken very seriously. The virus is now affecting younger people that are perfectly healthy, and then we've got the new Delta variant virus that's come out, and it's spreading like crazy. And the virus is worse this year than it was last year. I don't see it getting any better. Also, if you're for masks or against masks, it doesn't really matter. The facts are that masks do prevent small spit particles from getting put into the air. They do slow that down. They don't completely prevent the spread, but they do help. One thing I noticed about last year was, because of the mask mandates and stuff, there was a lower flu than previous years. The flu was way down. Anyways, it's good practice to maybe wear a mask in public. I know they're not comfortable. I would like to see other people smile as well. We need to do our part in helping, number one, our neighbor, number two, help lighten the load of the healthcare system so these nurses can take care of these patients that are in dire need of medical attention. It's our responsibility to be considerate of everybody else around us. Let me know in the comments below what you think, your thoughts on the coronavirus, on the vaccine, your thoughts on the state of the healthcare system, your thoughts on masks. It doesn't matter. Any comment you've got, I would love to hear it. And let's drop a like on the video. And as always, I stream over on Twitch. It's twitch.tv/Garza_205. I'm streaming over there usually every 2 to 3 times a week. I post my schedule on my Discord. I'll link that in the description below. Love for you to be a part of the community and put some comments on future content that you'd want to see me talk about, be it a career in EMS or healthcare. I'll see you next time. Catch you on the next video.